has some good stuff on there. Don't believe everything you read on the web. Support groups are awesome. Peers are really cool for getting perspective on these things. Kathy Favreau can, sorry, might not use your name. You know, the nurse at the hospital. People will talk about their journey with this, on this stuff. Don't be afraid to ask. Living healthy is its own reward, whether or not you have surgery, whether or not you lose weight. So the hardest thing for me is seeing the heavy girls, the 20-somethings at the gym every year in April, May, trying to be down at the bikini weight by June. And you know, they leave at the end of May because they've only lost 20 pounds and they want to lose 50. I just want to take them and say, do it for your health. The bikini may or may not come, but this is good stuff that you're doing. They work so hard, they do so well, but those unrealistic expectations wreck you. You know, they can be hard. They can be hard. And I have a lot of patients who come in a year and a half after surgery and freak out. Say, I can eat a cup and a half of food. I can only eat a half a cup the first year. That made me feel full. And they're scared they're going to go back to 5 cups of food. And that, anyhow, we all have to, there's a lot of ongoing care that we have to do in this and a lot of learning. But living healthy is its own reward. Stay engaged. If you're preparing, if you're thinking about this, well, you'll get frustrated, but don't get frustrated and go away. Get frustrated and stay engaged. A lot of this, it took me 3 extra months writing a check for my own surgery because my primary care doc said, nope, the blood pressure needs under better control. You know, anyhow, there are delays, there are coverages. This is a long-term, lifelong deal. Don't get too overheated. All right, that is my talk. I've got one slide that I put up for docs at the end of this, just because if your primary doc says, well, I've got a patient or two, to show them sort of the numbers. The average primary care doc, if there's about 25% of adults who are overweight in our county, which is about right, about 16% are clinically severely obese. And the average internist has 3,000 patients. Let's do the math on that. About 750 patients in their practice are clinically severely, or standard obese. They're all about half because they're under BMI 35. Now in 2012, that will be different. We're going to be operating on people for BMI of 30 because the medical data is coming. But they've got 180, 100 people in their practice, not 1 or 2. So I always have to throw that out. And that's my contact info. I'm going to be starting a new practice here in town, so that phone number is going to be a little tricky for a while, and the blog is just a blog right now. It'll be a full website in about another month or 2. I'm going to be moving from East South Verdata down to share office space with Dr. Barbara Bachman and Carrie Kaufman in the Parkway Medical Center. So some things are going to change for me too, and things are going to be slow getting off the ground in terms of organization. So, but if you just want contact for how to go down to the big program in Swedish, I'm happy to help. If you just want some follow-up from your stitches from Swedish, I'm happy to help. I interact with all these docs in the state. I know a lot of them. Madigan has a great program for vets, great program. Anyhow, I'm happy to be a resource. I don't have to be a surgeon to help people. So, thank you for your attention, and I'm sorry I didn't give enough time.
That's you, Bill.
Yeah, that's me. That's 2005, but I pretty much look like that in 2000. And that surgery, yeah, you know, that was my steady state at about 285, 290. My peak was end of residency when food was free and I was up all night more often. So yeah.
You got younger too, I see.
It's a very funny thing. You see me up close, I got wrinkles now. I didn't have them before. So, yeah.
Did you, how many people have to have a lot of skin removal done?
Good question. It really depends. Some on your genetics, some on your age. Smokers tend to have a little less elasticity. It's not everybody. It's probably, I think probably 10% of people actually get something done. Probably another 10% of people would really like to have something done. And every female, unfortunately, in our society, even Giselle Bootkin wakes up in the morning and looks in the mirror and goes, ugh, about something. So a lot of people would like to have something done. They do call it, what do they call it? They go from a 44 double D to a 34 extra long or something in terms of, you know, the breasts kind of deflate a little bit. And so, but not a lot of people, you don't see as much as you would expect. Or you see a lot more skin shrinkage than you would expect. So if you've been a lifelong smoker, and if you had real bad genetics where you're just unlucky with some of that, there are some people who really do have a lot of skin, but not as much. You see the extreme pictures on TV. They always scare you with this sort of Shar-Pei look, and most of those people have been over 500. Sorry. Most of those people have been over 500 pounds for a long time from a young age. But lots of people do have, you know, one tummy tuck. Yes, sir.
Well, I wonder what St. Joseph Hospital will do in relation to this. Are you going to be doing surgery there?
Going to be doing surgery there. Actually, already doing a little bit of surgery in terms of revisional operations. Our main issue right now, if there was no such thing as insurance in this country, I probably would have done 10 operations in the last 10 weeks. I've seen about 50 people in consultation already this year, just in my non-weight loss practice, because I have an interest and people find out. But St. Joe's, to answer your question, is set up pretty much ready to go. There's one tool that I particularly like that we don't have just yet, but it's a non-expensive tool. We've got the stuff to do laparoscopy and to do these operations. We do laparoscopic colon resections. They have the expertise to take care of people from a critical care point of view. You know, I tell people from the hospital, like, oh, we're going to have to get lifts. I've used lifts on like 2 out of 850 patients. One was paralyzed. He was a paraplegic from a motorcycle crash 5 years before, and had bad shoulders. And the reason he got surgery was he was diabetic. I think he was even 300 pounds. But he was 50, and he said, I can barely move myself now. I'm immobile. I'm gaining about 5 pounds a year. You know, 10 years from now, I'm not going to be able to move, and I've got these bad rotator cuffs. And so he used the lift a little bit. But we already take care of heavy people. They crash their cars. They get pneumonia. You know, we're already set up to take care of heavy people. Heavy people surgery. Most of our weight loss surgery patients are in their best health they've been in years, because they've been doing the WM program. They've been exercising. They've done a little liquid diet, usually for 10 days or 2 weeks before surgery, just to shrink the liver. It's not hard. I won't go into it too much. But they're in great shape. They get up and walk, you know, 2 hours after surgery, and we need them to walk to prevent blood clot, to prevent pneumonia. So on the floor, they're not any harder to manage than if you had your gallbladder out. So they're ready. I mean, there's more we're going to do. We're going to do more sensitivity. We're going to do more education for the nursing staff as we get busier. But they're behind it. They're supportive.
Can I assume that you do the sleeve? I mean, do you do one procedure exclusively?
No, sir. There are some docs who do. I was going to put, just one of the slides I took out because I go long. Northwest Weight Loss Surgery is a great practice in Everett. They do only lap band. They made that commitment a few years ago, or several years ago, and that's what they do. If you really, really, really only want a band and you're 1,000% sure, go talk to them. I think it's also good to go talk to another surgeon and find out if you have misconceptions about the other operations. But they're very good surgeons. Almost every other surgeon I know around does bypass, sleeve, and band. I don't know of anybody in the state, maybe 1 or 2 that do duodenal switch operations. I do plan to offer it. I've done several hundred gastric bypasses, and it is a harder operation. The science is coming along that the switch is a better operation than we were thinking. It is more severe. It creates more malnutrition, but in certain patients, it's probably the best choice. But there are a couple of other band-only surgeons. The band is the very least invasive operation. And that's easier to deal with. Everybody goes home same day or next day. Good questions.
So when are you moving your office?
In December, but I see patients, and that's why I put my card out now. I see patients right now even for weight loss surgery consults or for medical management. I do that as well. Dr. Burden at North Star, I'm trying to talk about the other practices in town that are available. North Star, Dr. Tony Burden dedicates his practice to medical weight management only, and then Dr. David Lauder comes up from Bellevue and is their sort of surgical component. So they are a comprehensive center, not all in town, if you will, but there's, you know, but medical weight management is available too. So, but yeah, I'm seeing people now, and I'll be in that new office in December. Cool. All right. Well, stick around if anybody has any more show and tell that they want to see, or, yes?
I was kind of holding back.
Yeah, oh, great, all right, here comes the tough one.
But we were talking a bit beforehand, and my job, I'm a family practice doc. I'm one of those know-nothing primary care docs.
No, everything.
no, I know a little about everything.
Yeah.
And I'm a county health officer. And one of the things we're doing, you were talking about the difference between, weight, treating obesity in individuals. And when we look at the population, there's some great maps that the CDC has that shows the percentage of adults with BMIs over 30% over the last couple decades. And every year, you just see the color change, and it looks like the pan-flu maps did. But it's a major problem in terms of the health impacts, the diabetes, the heart disease, the cancer. And so we tend to look at it as a system, and we're thinking, in public health, we're saying, how do we not only treat it as it exists, how do we prevent it, how do we deal with the early childhood thing where these metabolic set points get established?
And also, how do we find that one of his, I'm going to speak for you a little bit on that too, one of his jobs as a public health officer is not just to give everybody the flu vaccine, it's to find the most vulnerable people and get them the important treatment.
See, that's a bad example, because
Well,
this you're arguing to everybody, we're recommending it to everybody over 6 months of
If
age.
you have a limited resource, you do want to
Well,
want to find the most vulnerable people, and there are people who are, and that is where.
Well, let me continue my.
I'm sorry, yeah.
Come on, yeah, no.
But go ahead, I'm sorry.
But the issue is, when we see these maps showing the changes in weight, the question is, this is really intriguing, the things you've been bringing up about the hormones, the hormonal aspects of weight, and how it ties in with the anatomy. There are systems that have changed. Well, you're younger than me. When I was a kid, there wasn't deliberate going out and exercising or eating whole foods. That's what was around. Kids would be playing out front. Somebody would come out and yell, "Dinner's ready, come on in." And our neighborhoods felt safer, and there was more of a sense of, kids go out and are active. They're not watching the television, they're not sitting at the computers. We've shifted as a society, so there's some real systems involved in this change in our population that involve physical activity, that involve nutrition, but it's not just behavior, it's the systems we set up. It's how do we build our cities, how do we design our cities such that people have to get into cars rather than walking or riding bicycles. So if we start applying the health perspective on our design, on how we plan our roads and our communities, and how accessible nutritious food is, these are things that can be, especially in larger cities, these are things that can really make a difference and start to reverse some of these weight trends. That being said, there is a physical activity coalition. There are folks in the health department that are working specifically on chronic disease prevention, trying to bring in these networks, and we're really looking forward to your participation in that.